Talking health, the Osun State government says there are improvements in the uptake of a vaccination against human papillomavirus (HPV) in the state as part of efforts to prevent cervical cancer. Mrs. Roslyn Akinlabi, Adolescent Desk Officer, Osun Primary Health Care Board, spoke at a training for adolescents and youths as champions towards mobilizing their colleagues to take up health services. According to her, the move is part of ways to improve adolescent health in the state through sensitization. On the spot, one of the facilitators, a public health physician, Dr. Benga Debayo, said the workshop will also help to address misinformation around HPV vaccine and other health interventions.
Looking beyond, like this project, we are looking beyond HPV vaccine. That's why we call it HPV plus Niger. Saying that apart from HPV vaccine, what are other health services that adolescents and young people need? They need to be aware of their menstrual hygiene. They need to be aware of mental health. We want to stop suicide in our community. They need to know their SRA, sexual reproductive health rights. They need to be aware about life skills. What are the skills that they should have as a young people, or they have to, what they need to know about HIV transmissions and prevention. So beyond HPV, what we are doing here today is we are looking beyond HPV, bringing every services together, integrate all services together so that we can have a complete, whole adolescent and young people.
Okay, so we are here to build a new generation of youth champions to promote the uptake of the HPV vaccine. We know that there's been a lot of misinformation and wrong things said about the HPV vaccine and vaccines in general. So we are here to train young people that can take this message forward. And this project, the HPV Plus project, is to use HPV vaccine as an entry point for comprehensive adolescent health program.
Human papillomavirus (HPV) is a common viral infection, often sexually transmitted, with some leading to cancers like cervical, anal, or throat cancers. While speaking during a session, the Osun State Immunization Officer, Francisca Olaure, reiterated that the infection can be prevented with vaccination. Some of the youths at the training also spoke about the impact and reiterated their readiness to be change agents.
HPV virus is real. It's a global infection, but it can be controlled through vaccination, having a jab of what? HPV. You can have it as well. It might not be at the facility, but if you go to your doctor and a good pharmacy, you will get it there. Make sure at your level now you go for cervical pap smear, that's cervical cancer test, and then it will really go a long way to save the future.
Because there's a lot boys can contribute. I, as a guy, for example, on campus, I join initiatives providing information to more people, and I'm able to reach other guys who are also able to convince their sisters, their parents, and other people. So it's something everyone should be involved in, whether you're male or female. It's our collective responsibility.
As a young advocate, I aim to continue promoting HPV vaccine by promoting awareness, sensitization through social media, WhatsApp, Instagram, and TikTok in general, and also include my other young volunteers.
In the meantime, as part of moves to mobilize young people to take up health services, Osun State government officials and developmental partners led adolescents who were earlier trained as champions on an outreach. According to Mrs. Roslyn Akilabi, Adolescent Desk Officer, Osun Primary Health Care Board, the outreach was taken to schools and communities across some local governments in the state. The team visited Osogbo, Ife North, Ife South, Ede North, and Ede South local government areas, promote the importance of taking advantage of health services and interventions.